Cordoned off and empty. This was the scene at 115 Bukit Merah View Market and Hawker Centre when the Straits Times visited the area on the afternoon of June 22nd. As of June 23rd, it is currently the largest open cluster in Singapore with 82 cases. The once bustling area is now quiet. The hawker centre and the market are cordoned off with orange netting. Only a few people were seen walking around. The coffee shop at nearby Block 116 Bukit Merah View is still open, but the hawkers we spoke to said business is suffering.
I mean, very affected. I think 50%.
It's haunted now. People, even though the residents are around here, they're afraid to move around.
通常这边老人家比较多，应该百多200个人啊，对，现在买的那东西也少了，对，因为他对这个疫情，因为每个人都不敢来了嘛，所以就少了很多人。
Maybe people scared or what? I think scared. People don't want to come. Even you see the car park behind also empty.
This is how the cluster unfolded. June 13th, 182 hawker stalls at Bukit Merah View Market are closed for 3 days of cleaning after 2 Covid-19 cases in Bukit Merah are detected there. June 15th, Bukit Merah View Market and Hawker Centre is closed for further cleaning until June 26 after another 9 cases are added to the cluster. This brings the total number of cases to 25. June 16th, 14 more cases, mostly food stall workers and their household members, are added to the Bukit Merah View Food Centre cluster. There are now 39 cases in total. June 17th, another 17 people are added to the cluster, bringing the total to 56. June 20th, mandatory testing for residents of Block 116, 117, 118, 119, 124A, 124B, 125, and 126 Bukit Merah View begins. The cluster grows to 73. June 22nd, testing extends to staff of FairPrice Supermarket at 166 Bukit Merah Central. 5 more cases are added to this cluster. Total number of cases stands at 81. In less than 2 weeks, the cluster in Bukit Merah went from 2 people to 82. Dr. Leong Ho Nam, an infectious disease specialist from the Rofi Clinic, explains the several factors that could have led to the rapid rise in cases there.
Number one, many people were queuing up for food or they were close proximity, and in turn you could actually transmit easily. Number two, it is rather a hot place. You can imagine that people taking time off or not wearing the mask properly to get a bit of fresh air. Number three, many of these people will intermingle. It is not just at the food center, but the neighboring neighborhoods as well, including the blocks of where they live, the lifts where they use, and in turn, there's a lot of cross-mingling and cross-infection between them. Number four, there's also the ugly part of it, which is the ugly Singaporean. We've heard of people who have been feeling unwell, have been requested to see a doctor for a swab, but they declined or they refused. Or they know that they are unwell and they know that they will be hit with medical leave, and thereafter they just don't go in to see a doctor. The Bukit Merah cluster is the taste of future events and future clusters that will happen. We need to work together to prevent transmission, and truly the best way of protecting yourself is to not go out, and if you have to go out, even go beyond the 1 meter distance, go to even 2 or 3 meter social distancing. When you protect yourself from getting infected, you are protecting others from getting infected should you be sick. Eventually, vaccinations will help us open up the country safely, and the numbers are grossly insufficient. Whereas we have 50% of the population that want dose of vaccination. But for the Delta variant, this is not enough. People still fall very sick and people may still die. We need to get vaccinations up as quickly as possible.
While some residents admit that they are concerned, life has to go on.
Of course, I'm a bit worried, Worried is because I understand that this virus can spread very fast. And this area basically is all the elderly and the children. So actually, I'm more worried about their health. End of the day, I'm confident in all the actions, all the measures taken by the government.
好像我下来买东西的时候也是有点
想啊不要吃了，吃Maggi 面呐、然后哎呀也是不可以，只能吃Maggi 面呐、就下来走一圈这样啦。
Although the closure has brought some difficulty to residents' daily activities, they are playing their part to rein in the infection numbers.
Sometimes our neighbor also they are worried, no business, all this. They also worried. I think they also quarantine, get well soon, open soon, become normal, everybody make it happy.
I volunteered to do a swab test, although I'm not required to. That's one thing. Another thing is I actually monitor my own health and also my family's health, and also to ensure that they keep their personal hygiene properly. And also during this period, we try not to go out as much as possible.